All right, so I also want to introduce another idea to you. And this is, what is the life of a program? This is the life of a program. So the program goes through phases. And this is probably a slight oversimplification, but I think it works. So the first phase of a program is you design a program in response to a need that has been identified. And you look at evidence-based practices, et cetera, and you figure out what you're going to do. At that point, you haven't served anybody, right? You're just in the design phase. So then, once you start implementing, you don't just say, okay, there's my program, it's perfect on day 2. You kind of go through a phase of mid-course corrections. There you go. Ta-da, go through mid-course corrections. And so you probably tweak the program. In fact, at the end of mid-course correction phase, it probably looks slightly different than your original design. And to be honest, sometimes programs keep going through that cycle of tweaking, and they don't necessarily get to what the third phase is, but the third phase is important. It's sort of steady state for that program. That program has launched. We've done our mid-course corrections. It seems to be working well. It's reaching our target population. We think it's making change. So then this is where a program ideally should be for most of its life, right? And for each of those different phases, we have different kinds of evaluation activities that we use. All right, so while we're designing and mid-course correcting, that's more the formative phase of the life of a program, we design our program based on needs assessment. We use a logic model to tell us what we're going to put into the program, what kind of resources we have available, what we expect to happen, how those activities will bring about change, right? That's in our logic model. And then we might do some formative evaluation here to help mid-course correction. Now, we would never do, hopefully from this scheme here, you can see that we're actually not going to start out doing outcome evaluation in phase 1, okay? But there have been people who've designed outcome evaluations and started to apply them here. You're going to come up with the wrong answer if you do outcome evaluation too early. I've been involved in programs where, because funders care most about outcome evaluation, they immediately want that outcome evaluation designed, and they want the answer a year into the program or even 2 years, when in fact the program is still doing this a year in or 2 in. So if you do your outcome evaluation too early, well, you're going to come up with not the right answer about whether the program's effective. Okay, so just, this is a little cheat sheet to tell you when you can do things. Okay, now up here in the corner, I've said this works for simple and complicated programs, right? Because we know what to predict. We can predict things with simple and complicated. We can have a logic model in simple and complicated. We kind of understand cause and effect. Even if in complicated, it's separated by time and space, we can still predict that. So this applies. These kinds of evaluations can be applied to simple and complicated programs. I saw 2 hands here and there. Yes?
Clarification. So you're saying that mid-course program corrections occur before any outcome evaluation is done?
Yes, I am. But you doubt that? I'm all ears.
I don't doubt what you're saying. It's true. I'm just trying to understand like how you would correct mid-course without having an idea like whether you're on track to achieve what you said you were going to.
Yeah. So let me just say something more about that, if you don't mind. The one reason why we don't do outcome evaluation on day 2 is because outcome evaluation requires a period of stability. So everyone, let's say in our outcome evaluation, we're going to follow 300 people, okay? If person 1, person 3, person 7, person 8 get a different program because you're still tweaking, that's going to mess up your outcome evaluation. You need to have a group of people in your treatment group for outcome evaluation who pretty much got the same thing. And if your program is changing and evolving, it's kind of garbage in and garbage out for the people who got treatment. And really, it's not garbage in necessarily, but it's such a heterogeneous group. What can we really say about those 300 people who didn't get the same program? So that's one reason why you don't want to start your outcome evaluation data collection on day 2. You want to make sure the program is pretty much the same for all the people who are going to be in your treatment group in your outcome evaluation. So we've got a question back there and then over here. Yes?
So what you're saying definitely makes sense logically, but politically and when you get funding, they want that, City Hall wants that outcome evaluation. So what do? Do you try to push back? Do you just do it and the results are in the crap?
Well, you can educate. So I, for the last 3 years, have been working for a funding or consulting with a funding body that plans all, so I'm from Toronto, and the health system is public there, and so there's a planning body that plans for the health of Torontonians. It's local and regional, and they wanted to improve their use of evaluation. And so some of the early days when we sat at the table with them, they were all about, okay, here's 6 programs, what's their outcome evaluation? So I'd ask them, well, how long have they been operating? Well, we just started a month ago, and we want an outcome evaluation. So we kind of had to go through the exercise. Actually, I showed them that the reason I developed this was for them. I developed this for them so that they understand, oh, what happens if you do the outcome evaluation too early? We can do it if you want, but you're not going to get the answer you're looking for. It opened their minds to the idea of doing process evaluation. Because one of the things that maybe you'll learn later when we talk about the importance of implementation evaluation is that studies and literature reviews have shown that very few people are actually getting when you do outcome evaluation, relatively few people are actually getting the program as it was intended and designed because of a lot of implementation failures that happen here. So if you don't monitor what's happening or document it, doesn't matter what your answer is in the outcome evaluation, you're not going to understand anything about how well that program was implemented. So yes, the answer is push back in a nice way. And so I'm happy to report that, they never used logic models before. They never did process evaluation. And they realized that because they don't do the services themselves, they fund others, that those they're funding also care about process. But they were never allowed to before because they were funded and said, okay, get going on your outcome evaluation. Now they're opening up the possibility of programs doing a process evaluation. And they're requiring logic models, which is something that they hadn't done before. Because everything before not only was about outcome evaluation, but every single program in their portfolio was about reducing emergency room visits. And when you do the logic model, you'll find many of the programs weren't or couldn't possibly reduce emergency room visits. Yes?
I just wanted to ask you a little bit about when you said that the people participating in the programs are pretty much getting the same thing. It's okay to measure outcomes. And I work on a project that borders on complex. And we do have a lot of pressure to look at outcomes. And in our implementation model, we have program fidelity kind of on the causal pathway between the intervention and the outcome. And our hypothesis is the better the fidelity or the higher the fidelity, the more likely you're going to get, the better the outcomes, proportionately linked to the outcomes, and the more able we're going to be able to attribute those outcomes to our program. But that said, we have varying levels of fidelity, which we measure quantitatively.
Yeah.
Establishing a minimum level of fidelity is really difficult when we're not, it's a complex intervention and we're not sure that the things that we think are important right now for fidelity are the most important. Are we weighing them too heavily? So one of the temptations is to measure the outcomes and then see, are they attributed to fidelity, but that the level of fidelity, but if we let the minimum be very, very low, does that really, how does that hurt us? We're kind of at this juncture right now where we have data, we also have varying levels of fidelity, and we don't know what's the most important lever for those outcomes yet.
Yeah. So if your program is complicated, you can probably provide use and apply traditional models. if it really is complex, you may have to do something else. So maybe we can get through the what do you do when it's complex, and then you can see if some of those ideas might apply to your situation. Okay, other questions? Yes? Sorry, I'm just going to ask everyone, when you're asking a question so that I can get to know your names, can you just say what your name is?
Oh, my name's Kristen Mark.
Kristen, okay.
Formative evaluation. Can you define what formative means?
Yes. Formative evaluation. So, as the name suggests, it's an evaluation, a set of activities that is trying to help you form your program. And so you're often not that concerned with outcome. There you're concerned with, are you reaching out to the right people? Did the educational session that you deliver, what was kind of the post-test on that? Do people actually learn something? Did they take something away? It's not quite an outcome evaluation. It might be done on a smaller scale. You might do a focus group to make sure that people are happy with the program, that kind of a thing. It's smaller scale, and it's not designed to be the outcome evaluation. And formative, process, and implementation share a lot of strategies, which we'll go into in a little bit when we talk more about process evaluation. So we're going to talk about process evaluation this morning. Any other comments or questions before we move on? Yes? Your name. Thanks, Beth.
What do you see as the role of the logic model as a living document when looking at the program implementation and then further iterative processes of team evaluation?
Okay, so I love that question, and we are going to be able to explore that more because we're going to have a whole session on logic model, but the quick answer to that question is logic models are often seen as, oh, let me just fill this out, and then it gets on a shelf. So when you said living document, that's exactly what it is, and all stakeholders need to be familiar with it, carry it around as you do your mid-course correction. So remember I said maybe here the program is going to be tweaked enough so that it doesn't look like your original logic model or your original design. So you update that logic model so that it reflects what your current thinking is. Rarely does that happen, but that's the ideal. And we'll, again, have an opportunity to talk about that in a moment. Any other questions? Thank you for your questions. Okay, so now we're almost to the answer of what do you do in a situation that's complex. Let's first review what do we do in a situation that's simple and complicated. So we often start with a logic model, and we know where we're going. We know what our outcomes are because our logic model told us what they are. We know the path forward because we've reviewed best practices, and we're kind of on our way here. So we have our inputs, we have our activities, we have our outputs, outcomes, impact. If you've done a logic model, you'll recognize those categories. Very linear, sequential, and predictable in theory. And so we can do our formative and our summative evaluations, okay? So I need to say something now before I forget. So even though I'm telling you about a lot of these tools, there's no program that uses them all, okay? Rarely do you have enough resources to even do one type of evaluation. I'm telling you what your options are, but I'm not telling you, okay, and do all of these for program X, okay? So you do a formative, or you do a summative, or you do some kind of a combination. That's what happens with simple and complicated. What happens with complex? We may start with the logic model because we're not sure if we're encountering a complex situation or not, and we have our inputs, but then, and we may start some of our activities, but quickly that logic model falls away because it is a complex process to try and get to our vision and outcomes. In fact, along the way, we might find that some of the activities that we implemented are taking us off track, so we need to stop those. We may find some of the activities that we implemented are going off track, but there's a way to bring them back on track. So we might, remember, we're looking backwards. We're probing and looking backwards. So we may be able to bring them back, okay? But it's not a linear path. So what kind of evaluation do we do? we do something called developmental evaluation. Developmental evaluation is something that occurs over time in multiple time points to help us remember we're probing and we're looking backwards. So here we probed and we said, hey, what's going on? Whoops, it's going in a wrong direction, so we're going to stop that. Here we're probing and what's going on. Here we seem to be going in the right direction, but then when we do more developmental evaluation here, we realize we've gone way off course. We should be on this course. So then we change something and we do it differently, okay? So at different points in time, you're going to be doing a developmental evaluation to probe and to look back and explain and sense and then move forward, okay? What is developmental evaluation? It's a type of evaluation to inform and support innovative and adaptive development in complex, dynamic environments. Before we go on, I'll say that while I showed you that picture where everything looks, well, complex, often one of the goals is to be able to steer your program or components of your program to a point where it becomes either complicated or simple. Okay, so you're trying to get it so that it comes to a place where it's a little more manageable. Okay? All right, so developmental evaluation brings to innovation and adaptation the process of asking evaluative questions, applying evaluative thinking and logic, and gathering and reporting evaluative data to support project, program, product, and organizational development, probably with timely feedback should be underlined as well. So when we have a simple or a complicated evaluation situation, often you can have an internal evaluator, external evaluator, maybe the evaluation team kind of goes off and does its own thing because everyone agreed on the design, and then you have people the staff of the program who are worried about delivering the program, and other staff for the evaluation who are worried about doing the evaluation. And they can work in parallel, but they can work separately, not here. In developmental evaluation, your team is integrated and you work together because there's real-time feedback and you're adjusting as you go along, okay? So that's one big difference, is that your team's got to work together, real-time feedback, and the people at the table have to be able to make changes to that program. It can't wait for 6 months till the next advisory board meeting to see what people want to do. That's not developmental evaluation, okay? What did I push? Okay. Okay, so developmental evaluation is appropriate when the processes are highly emergent and volatile, the environment is dynamic, it's difficult to plan or predict because the process is non-linear. There's often no known solutions to the issues, in part because they're complicated. Multiple pathways forward are possible, so you want to use evaluation to decide, okay, which pathway should I use to go forward? It's socially complex, requiring collaboration, sometimes among different stakeholders in different sectors. It's innovative, you're innovating, your program is innovating. It's not just applying known solutions to a situation, you're actually innovating. And there's unknown outcomes. So the vision and values drive the process more than, I know that I'm going to reduce emergency room visits. Equally important, and maybe more important, is when is developmental evaluation inappropriate? So when people are not willing to commit the time to actively participate in the evaluation, okay, and to build trust. And you have to expect a lot of failure in this, okay? So it's not like, oh, we're going to get together and we will only find the pathways to success. You're going to find a lot of failure here, and that requires a level of trust between everyone at the table and evaluative thinking to question, skepticism, to say, you know what? I don't interpret the data that way. I just don't think it's working. You have to feel comfortable to say that. Where key stakeholders require high levels of certainty. If in fact, someone says, well, I've got to have that outcome and that's the only outcome that I care about and everything else doesn't matter, Well, that may not be the best way to do developmental evaluation because remember, outcomes are unknown. Where there's a lack of openness to experimentation and reflection, when organizations lack the adaptive capacity, if they can't change, if they said, we're stuck, we have this staff, we have this resources, we have this strategy forward, we're not doing anything else differently, if they're unable to adapt, then don't even bother with developmental evaluation. Anyway, you can read the rest. So those are inappropriate situations to be doing developmental evaluations. Hopefully you have a flavor for how developmental evaluation for complex situations is different from what we might encounter in simple and complicated. One is not better than the other, but the whole idea of this little segment here is to help you understand how you use the right evaluation tools for the problems that you're trying to solve and the programs that are being implemented. Yes?
So if you have a grant that you have measurable outcomes that you have to report, let's say on a quarterly or a yearly basis, would you disregard any developmental evaluation, or would you say, we just know we have to do these, but they're not going to be our main outcome? Their main outcomes from the funder, but not us? I mean, how do you think about this? Because you want to be more progressive than saying, okay, we're just going to reduce teenage pregnancy, and if that number goes up, we fail. Goes down, we've succeeded.
Yeah, well, I think often funders have unrealistic expectations of how, I think that oftentimes funders describe programs and the evaluation expectations as if they're simple. So we know what the outcome's going to be. We know that the pathway is going to be this way, or complicated. I personally think there's benefit, even in complicated situations, to measure more than just the ultimate outcome, because I think we do want to understand the pathways. One thing we don't have enough of in the evaluation literature is how do we track the pathways to how change happens? So for reasons other than just satisfying the funder, you may want to look at outcomes. In addition to the main outcome you need to for the funder, you might want to look at other ones that are relevant and important for that population and that program. Maybe you can use some of that information to show that you had impacts in some of the the proximal determinants of that ultimate teenage pregnancy outcome. And sometimes the time window for the ultimate outcome is too short, really, in evaluations that we have. So if you can show impact on some of those proximal determinants, you may be able to say, we've been able to show that we've had an impact on the proximal determinants, not quite the outcome yet. Maybe 2 more years we might be able to, or I don't know, I'm just kind of making this up. So I think putting on your evaluative thinking hat and thinking critically about your logic model, the time frame, all of that, and being able to explain why you think it's important to not just look at teenage pregnancies, but these other outcomes that are on the pathway, and then doing so for the program. So one is satisfying your funder because you want to have more funding, but another one is we want our population to have the best programs possible. And if we don't understand how they work, whether they work and how they work, we're not going to be able to tweak them and do that mid-course correction. So even saying, okay, I understand that the outcome is teenage pregnancy, but we need to even make sure that the program is being implemented well. Maybe we need to do a fidelity assessment. Maybe we need to do some process evaluation. I think trying to negotiate that is important. That's my own opinion. I think if you can come up with some good rationale, hopefully the funder is open and wants to know that information too. I think everyone around the table, the program, the participants, the funders, probably all want the same thing. They want effective programs for the population. And a lot of times and in a lot of areas, we keep doing the same thing over and over again, and it's not like we've generated the information to help us do a better job next time.
We just pick a different program because we didn't get the outcome.
Yeah, right. And all those factors that I told, maybe we did the outcome evaluation too early. Maybe we didn't, So some of the implementation literature suggests that only 20% of people are getting the program that they're intended to get because of implementation failures and all of those things. Because we don't do process evaluation, that's a really bad grade. We need to do more evaluative thinking, process evaluations, implementation evaluations to guide our work and not just rush to get to the outcome. That's a really long answer to your question. I'm sorry. Okay. So I just wanted to share with you something we did in Healthy Start program from a long time ago. And so here, this was kind of a complex situation. It was a complex situation. First of all, we had multiple areas that we were dealing with. We were trying to recruit and serve a very high proportion of the target population. We were dealing with issues of poverty. So, of course, our outcomes were reduce infant mortality. That's what we need to do when we're dealing with Healthy Start. But in addition to that, some of the pathways by which we were doing that was improving the economic circumstances of families. We were improving early childhood development and improving parenting skills. That was kind of the goals of this Healthy Start. So we were also dealing with maternal health, mental health and other physical health, and then parenting issues. And each of those areas had multiple strategies within it. So for example, we wanted to make sure that we were reaching at least 70% or more of those moms, pregnant moms and new moms in our target area, because if you only reach 30% or 40%, you might be reaching those who were the worried well, right? They're the healthy folks. If you reach 70%, then you're really getting a high proportion of the high risk as well. In terms of poverty, it was very much a very low income population. So we wanted to build up their employability skills and prepare them for taking on jobs. Also dealing with mental health issues, pre-existing mental health issues and substance use issues, and then also dealing with parenting. So why was this complex? Not only is it multi-level, but over time. So this is more like the final model. This was after several cycles of the mid-course corrections. Did we get to this? Initially, if you look at the initial, very, very first program, it really was just focused on recruiting participants here, and it was also looking at getting clients into prenatal care. That was probably the simplest version of this program. And as that didn't seem to work very well, because as we were recruiting, no one was really we had like transportation to prenatal care, and they weren't interested in that. We discovered that what they were interested in, what they needed, was taking care of their urgent needs. So we had to deal with issues of poverty next. So they added on a whole bunch of strategies that would deal with poverty. And then once those poverty issues, the immediate needs, those urgent needs were dealt with, then women could begin to think about prenatal care. And also there were a lot of mental health issues and substance use issues that were being faced by the population. And so there was a need to actually integrate better with substance abuse program and in a way redesign that program in that particular site. And then the parenting program was an early idea, but the strategies that were implemented and redesigned, et cetera, just never really took off. So this was in a way a developmental evaluation. We didn't design it as that, but it went through the many, many iterations of the program. Okay, so what did that look like? We were dealing with poverty, as I mentioned, maternal health, recruitment issues, and the recruitment issues led to kind of more home visiting programs, which also showed unintentionally, we didn't necessarily design this in the program, but it showed, for example, that social support was perceived to be very high when home visiting was happening, and when we recruited, so Healthy Start was a very well-known program in that target area because outreach workers would knock on people's doors every 6 weeks and talk about Has anyone pregnant, become pregnant, moved in who's pregnant, a new mom, that kind of a thing. So there were jobs and literacy issues and housing that needed to be dealt with. These are the parenting education classes, which weren't really helping us achieve the vision in the beginning. Here, by the way, are some of the outcomes that we were trying to target. So as I mentioned, the parenting outcome, parenting education classes just didn't really ever take off properly. But some of these others were monitored and improved so that they would help achieve the vision and the outcomes. But it was a complex process. And the other thing to keep in mind when you are doing your outcome evaluation, ultimately, is that there are many other programs or influences on that outcome, right? So I'm just telling you about one program that was going on in that city, Healthy Start. But there were other programs dealing with a lot of these issues that it wouldn't be clear if we could rule out that it definitely wasn't them and it was just Healthy Start, right? Because you've got competing programs. Yes?
Marie saying, how do you come up with your outcome goals? Or are these based on what other programs have done? Or let's say, so recruit about their interested. Where does that pull?
That was through learning, to be honest. This program started even before the Healthy Start funding became available. And when this program first was started, they actually built a building in this neighborhood. Beautiful on the inside, really welcoming area, and they just kind of threw open the doors. Not many people showed up. They said, okay, now we have to go out and recruit. And then as they were designing the outcome evaluation for that early version of the program, they realized that they're getting a lot of people in there who were the worried well. So they would have survived with or without the Healthy Start program, or what it was called before. And so they said, okay, we need to really, in this target area, reach 70% or more, because then we'll be engaging the high-risk population. So it was through, that's why I'm mentioning developmental evaluation. At that time, this is a long time ago, developmental evaluation didn't exist. But in a way, that's what was happening, is we were learning as we went along. Yes?
It seems that you're going to have to really closely communicating with your stakeholders for any kind of developmental evaluation. Are there examples of developmental evaluation plans that are out there online that are published and available to the public for high-profile programs?
So I don't know. There is a book called, I don't think it's called Developmental Evaluation Cases, but that's essentially what it is. I don't think there could be a plan. A plan somehow suggests I can predict what's going to happen in the future. It's probably more like a team that works together. So in this project, the evaluation team and the program staff met weekly, if not more, and they would discuss what was happening and try and figure out a way forward. And there was an openness to change. So all of those things that I mentioned to you were happening here. It's more about values and moving toward your mission and values than it is about particular outcomes in an ideal world. So we also had to say, yes, we're absolutely reducing infant mortality, even though we knew it was very much about poverty reduction and other things happening. So I don't know if there are plans. I can try and get for you at the break the name of the book that I ordered and I haven't looked at, but it's like a set of cases, I think.
Our stakeholders are not as patient sometimes with so we have a process and we have a lot of communications about our evaluation strategy, and some of it is clearly in this developmental area. However, we do occasionally get asked, so the plan is sort of this in between this sort of traditional and this less feeling traditional developmental thing. And it would be great to have an example of somebody who said, this is what we're doing a developmental evaluation, here's our timeline, or at least what you can expect from us, so that we're not constantly sort of defending our need to do this developmental
Yeah.
work.
I think going down the when it's not appropriate and seeing how many of those things you can check off would be important, because if they're not interested in knowing about failure or being open to change or redoing things, then it would be, I think, a wasted effort. Okay. Oh, was there another question? No. Yes.
So in an ongoing program, is there a recommended time as to when to do the developmental evaluation? Every 6 months, a year?
No, it's an ongoing process. So discussions about your results and what you're doing is an ongoing process. So you don't say, okay, January, we're going to meet, we're going to see what we do, and I'll see you in June, right? So this program here, there are many moving parts. So even if we're not looking right now at home visiting, because that's over here, maybe I can look at the education classes now. And then in 2 weeks from now, or a month, I'll be looking at home visiting. So there's many moving parts. You can always be looking at something. And you can either monitor things as you move forward, and if you're uncertain what's happening, you can say, okay, maybe here's where I'll do a developmental evaluation. So you don't kind of say, okay, I'm going to do a developmental evaluation here and look at everything. I'll look at a slice of the program here, and a developmental evaluation here, and I'll look at a slice of all the components here. You sort of need to do it component by component, because each component has its own theory of change, right? I don't know if I put it on that slide here. No, I didn't, but how were we reducing poverty? Well, the idea is that we reduce poverty by preparing clients for job readiness, giving them jobs. So in these neighborhoods, Healthy Start was the largest employer. They were actually hiring people from the community. And so getting them ready for jobs, giving them jobs. Some individuals didn't have strong literacy skills, so giving them literacy skills before they could get ready for jobs. So that was kind of our assumptions of the program. We needed to make sure that those were true. So maybe doing an evaluation around, and then also housing. Housing was a big component of poverty reduction. Looking at that poverty component would be different from the kind of developmental evaluation I might look at when it comes to maternal health. So what was available for women who were pregnant and having to deal with substance use issues? Or we also found there was a large proportion of women who maybe weren't doing substances themselves, but their family members were, or their partner was, and they were directly affected by that. And where could they go for help? Because they themselves weren't dealing with addictions, but it affected their everyday lives. So we might have a different kind of developmental evaluation for health versus poverty versus recruitment. So they would be on their own timeline. And we would have to deal with all of those as a team, but we might have different designs for our developmental evaluation pieces for each of those. Does that make sense?
Yeah, it does make sense. I guess what I had in mind is for a program that does not have the capacity of like an in-house evaluator. Like if you were to hire or contract with someone to come in and do the evaluation for you, maybe not be with you like on an ongoing basis, but will just be brought in to do the evaluation. I guess that's what I had in mind when I asked.
Then I wouldn't do a developmental evaluation, because if they're not able to really integrate, that's a whole nother discussion. Internal evaluator, external evaluator, but if they're not really able to really know the intimate details of the program functioning and all of that, because they can only come in periodically, I don't know that developmental evaluation is the right approach. Again, look at that checkbox about when it's appropriate, when it's not. And so there is a free developmental evaluation primer online. I'm sure if you Googled developmental evaluation primer, you'd be able to find it. Jamie, and I can't remember his last name, wrote it, and I can't remember if the team issue is dealt with in that primer. But the team issue for developmental evaluation is really a critical, important component of it. Yes, in the back.
So I'm thinking of process evaluation and implementation eval. Is that so different from developmental evaluation? Because in process, you're also looking at the things that you can change as the program's happening. Is there a big
In that sense, it's the same. But remember, for developmental evaluation, you have a complicated situation where things are dynamic and unpredictable. For process evaluation, and maybe you said formative or implementation, remember, those are for complicated and simple. So we can predict what's happening. We can make a logic model for those, and then we can determine whether we're reaching our intended and predictable goals. So developmental evaluation, in a way, you can maybe cut up the program and use some of those tools for developmental evaluation. But I think the purposes would be different. It wouldn't be about the program as a whole. So I wouldn't be doing necessarily a single process evaluation for all of this. I might be doing it for components of this. Yes, Judith.
So I was thinking about, I work with an evaluator all the time, and sometimes it makes me nervous when he says, okay, so what should I collect? Or which week should have them collecting the data? And of course, as an epidemiologist, we want to have them collect everything, but it can be very arduous for the people who are actually doing the program. So I was just wondering if you could just go through one example of how you nitpicked what you were going to have them collect to say, so engage them in their own issues or urgent needs. So was this done qualitatively, quantitatively? You know what I mean?
I think it was done, well, we also had funder-imposed requirements, which in some ways helped us. In other ways, it didn't. So we had like a management information systems where you could collect a lot of data. In this particular case, for managing urgent needs, at intake, even before we did the baseline interview, in order to engage the population, build trust, help them feel that they can trust the program, the first thing that was done is, hi, we're Healthy Start. What are your urgent needs? So everything from, I don't have a refrigerator, to my landlord won't fix my windows, to I need diapers, I need formula, whatever it was, there you go, you've got it. And we kept a list of whether or not people used that, because some people said nothing. Not many people said that, but we're talking about very, very poor participants. So usually there was something, and we could see, oh yeah, every person had at least 3, sometimes 20, and what were their needs? We could categorize that too. So there was no doubt after we started that process, that was the way to engage the population, to help them, to stabilize them, because when we meet them, if they don't have any food for their kids or they can't keep their food because they don't have a refrigerator, that's something that's going to be on your mind. Who wants to talk about, now, did you get into prenatal care in your first trimester? No, they're worried about their fridge and feeding their kids, okay? So once we could address those issues and they felt like they could engage with the other parts of the program, then we kind of went on. But it was a quick, easy, kind of formative evaluation of that. Like, yes, that was needed. Almost all the participants needed that to happen.
So what I'm thinking about, it wasn't sort of like, I find some funders do like, we're going to have this big database and we're going to start having put all this stuff in.
There was a minimum data set,
But
minimum
at the
in
same
quotes.
time, when you did that, you kind of said, well, let's just start off with lists,
Yep.
and we'll start off with,
And
does everybody have an urgent need? It's almost like a yes or no, and then when you go to the yes, to what extent?
Yeah, and some of that was discussions because the case managers had a discussion and they said, yeah, there's hardly any people who don't take advantage of that. Okay. All right. And so the other thing I just wanted to point out is that when we talk about complex, so does anyone know what this is? This is from WHO, the Commission on the Social Determinants of Health. There was a landmark report that was launched and released in 2011 called Closing the Gap in a Generation. Sir Michael Marmot was the chair of the Commission on the Social Determinants of Health, and he documented that every country in the world had growing health inequalities, and that those health inequalities needed to be closed in a generation, so closing the gap in a generation. And this is their conceptual framework for what the determinants of health are, okay? So if we think about health and well-being in a population or health equity, there are these intermediary determinants, and these intermediary social determinants of health are things that I'd say 90% of the literature deals with these, right? They're medical circumstances, behaviors, smoking, physical activity, biological factors, psychosocial factors, so there are these. But then he calls these, or he and his committee call the structural determinants of health inequalities, the causes of the causes. What are those? Those are the political context, policies, social policies about jobs, minimum wage, for example, housing, affordable housing, rent control, et cetera, public policies on education, social protection, all of that. These are really the social determinants that result in social inequalities and social class inequalities, which then contribute to the shaping of these intermediary determinants and health outcomes. Why do I tell you about that? Because a lot of the causes, which if we don't change those, we're not going to actually close the gap, are really about complexity. Sectors working together, sectors with very different cultures who have to come together and work together. Some of the work that we're going to do today is about the health sector coming together with the housing sector, and how is that done? We're talking about definitely complicated, if not complexity there. Okay, any questions about that before we move on to one last topic? Yes?
You mentioned it earlier. If you could talk just a little bit about the structure of the evaluation team. A lot of us don't have resources to have an entirely internal team that can do the evaluation,
Yeah.
or hire an external. And we've been playing with a hybrid where one does the meta and the other one does kind of the micro evaluation. But could you talk a little bit about that? Because she said that's another kind of big topic, and I don't think it's addressed in the slides.
Yeah, you're right. I think that, here we go. So there's no one right answer for any program. And I'd have to say that very few times, I've done dozens of evaluations, very few times have there been adequate resources to do that. And that's always a challenge. But I would say there are benefits to having an external evaluator do outcome evaluation because, in theory, you're more objective. You don't, if you're staff, you might have a explicit or implicit motivation to show that the program's successful. Clearly, your funding depends on it. So there's reasons, if you care about the rigor of and the perceived validity of your evaluation, to maybe have an external evaluator. And in some ways, it's easier. An external evaluator who's doing an outcome evaluation doesn't necessarily have to know all the details versus an external evaluator coming in and doing your formative evaluation or your process evaluation. So there, you might be able to have staff do some of that, because there you're tweaking your program, making it the best that it can be, and those who are more removed are not necessarily going to get it right for that. So depending on the kind of evaluation you're doing then, because some programs just do formative or process and they don't do outcome. You'd have to make the decision based on those kinds of considerations in terms of what's best for internal versus external. I don't know if that's helpful.
Guidelines that said, oh, external is best for this. The guidelines would be really helpful because there's a political aspect of this as well. It's hard sometimes for research staff or staff that are external to necessarily tie the intervention to the implementation.
Yeah.
Pieces kind of
Yes.
ground knowledge,
Yeah.
and then attribute that through the outcomes.
Right.
Can be really difficult.
And I think it depends on your outcome evaluator. Let's say you do external. Some are really just contractors, and what they care about is paying the bills. And they'll do, I don't want to say they'll do anything, but they're not as invested in the program and the meaning of that evaluation as other consultants might be. So that's something that I think programs should pay more attention to when they hire people. I think that's really important, is getting the right fit with a consultant. I've seen way too many evaluations which are just, consultants have one model, they apply it to every single situation, they collect the data or they use program data, generate their report, and they're now moved on to another program. So you have to be careful about that as well. You know, sometimes you can use an external consultant to help with the design issues. If they have a wealth of expertise that perhaps program staff don't have, use them for, you know, okay, what are our options for design? And then maybe implement it internally. That could be another hybrid model. I don't know, does anyone else have some comments on this? Some of you have done evaluations. Internal versus external. Yes, in the back.
I'll share a little bit. For
Okay.
MCHEPI, our MCHEPI grant, we have external evaluators at our Michigan Public Health Institute, and they're wonderful. They are so knowledgeable and experienced. So my internal role is really just helping support them along the way. And I guess I have no evaluation experience other than like needs assessment, which is a little bit different or different piece of the process. So it's great to hear this overarching kind of big picture.
Okay, good.
Thanks.
Does someone else have their hand up?
I was going to say, Kyra, and within our health department, we have, so some of our programs do sort of external evaluators, and sometimes that's really great, and sometimes it's kind of that, oh, let's just throw something together. And,
Okay.
You know. But one of the things we've been trying to do within our public health performance division is sort of build a pseudo-external evaluation. So all of those folks in the health department who have training and
Oh.
evaluation, we've developed plans based on the CDC evaluation plan.
Love that idea.
And work with the staff to, okay, well, what is it that you need for your program, and then kind of go through that process. So it's kind of a balance.
Love that idea. So you have people who are not directly into the day-to-day enmeshed in this program, but they are part of the organization, helping you design some evaluations and give you some ideas, building a community of practice in your organization. Fantastic. Yes?
Our health department has a staff in chronic end stage program now of 6 people who do this work, and they contract out their time to different programs. But they're completely separated from day-to-day operations.
Okay. Great. Another great model. Is that helping you think about some?
No, we leave it sort of, it's a balance that we have fantastic partners. It's just that they're not co-located, and also the evaluation resources are controlled by different people. And so part of that evaluation management becomes challenging when one group has all the data and the other group has all the literature and a lot of the
Right.
experience in doing the research arm. And so it's sort of figuring out, so how do we make all of this work with really a small team of people? And you know, we have a politicized environment as well, so we need the clout, but we need the kind of, like I said, boots on the ground expertise in some of this
Yeah.
work as well. So I think we've got a great relationship.
Yeah.
I just don't know how others do it. And I'm always finding external resources like the CDC evaluation plan to talk to our stakeholder community to say, you know, we're not moving as fast as you want us to move because we're in all different stages of program maturity, and look at CDC or look at FERSA. So asking for, you know, what are other people doing is really helpful, so that I can say, you know, it's not just us being slow
Yeah.
or not getting there quick enough. This is a best practice.
Right.
So I'm just trying to get best practices.
Yeah. And you brought up, I think, a couple times, and I think it's really critically important, although we're not talking about it today, and that is the political aspect of evaluation. We are talking about technical aspects of evaluation, and we can be perfect, but if the political will isn't there, or we haven't properly attended to the political issues, then it can all go wrong, or it can be done beautifully and then not be used. So there's all kinds of political issues that are relevant for, well, any kind of research, really, but for evaluation that should also be attended to. So I think we have some sessions on knowledge translation and we can talk about that, because I think that's really key to attend to those issues from the beginning, including engaging the stakeholders in the beginning. Yes?
So I work with a lot of tribal communities, and our organization, we're in the Tribal Learning Center, we really try and get away from quantitative evaluation, because we feel that our communities, although our funders love it, our communities do not. So we're trying to really mesh a qualitative evaluation in with our quantitative, because we're trying to really satisfy two different
Mm-hmm.
groups, and that we find that it's actually enhancing the quantitative aspect, because, as epidemiologists, you get really kind of ingrained in numbers and a Likert scale and trying to transport everything. And I think it's really helping us actually do a better job of implementation.
Oh, great. Wonderful.
It's been hard on me. I have to.
Yes, I understand. Being an epidemiologist, yeah, I would agree. I think having epidemiologists really embrace qualitative work can be challenging. All right, let's move on. We have one last, let me just check the time here. All right, I think what I might do is, I'm deciding whether we should really talk about the next issue. Well, let me see. Maybe you're all familiar with this. So who here is familiar with realist evaluation? I wanted to introduce this topic because it's becoming increasingly prominent and relevant and used, and it complements our existing approaches to evaluation. And I thought, at the very least, you should be familiar with it, because it may. Has anyone come across this at all? Never. Nothing. So you can see that it is increasing in its use. Maybe I'll go through this quickly. And if you want resources, then we can talk about that. But realist evaluation, then, is based on a philosophy of science that is called realism. So as epidemiologists, do you know what philosophy of science we are taught in? Yes, tell me.
Oh, goodness. You want to know which philosophy of science?
Yeah.
Or just in general?
So which one?
Oh, goodness. I don't know.
We're positivists, yes. We are taught in positivism. That is, the idea is that we can measure the truth. We know what it is. We can quantify it. We can look at statistical relationships between statistical quantitative variables, and that is the truth. That is the way the world works. That's positivism. Way on the other end of the spectrum, we've got subjectivism, and that says that actually there is no universal truth, thing that applies to all of us. Everything is constructed in our head, okay? We experience the world and we understand the world through our own experiences and our perceptions, and that's the only thing that matters. Now, there's a problem with that, because that means then there's no universal theories, et cetera, but that is subjectivism. It isn't for us to rewrite these different philosophies, it's to be aware of them. There's another one called realism, where it acknowledges that there is a real truth, but it's not necessarily one that we as humans can measure and sense and know. We can't know it. We're limited. We're limited in our ability to know it. The best that we can do is explain what we know now and then improve through scientific methods what we know about the world. Realism is about explanation, theorizing and explanation, more so than it is about measuring and quantifying, okay? So that's a very, very, very quick way of comparing and contrasting subjectivism, realism, and positivism. Why is realism taken off? In part, maybe it's sort of fueled by this idea that numbers alone tell us a limited truth. Numbers alone do. But also, there are people who reject the idea that we can actually measure it quantitatively and that the statistical associations that we generate are actually the truth or the causes. Okay, there's a different way of thinking about causality even in realism. So I think realism has come about in response to both subjectivism, which I think there's a lot of people who reject the idea that we can't have universal laws in truth, and we can't just measure something and say that's the absolute truth because we've quantified it, and then there's something in between. And a recognition that, in fact, science is socially and contextually dependent. We are shaped, our knowledge and our science is shaped by our context. We know that science has evolved over time, that science has been influenced by some of the ideas of the day. We can think about how women were perceived and explained scientifically before. We know the history, for example, this country has about race and how that was explained scientifically in the past, and we reject those ideas now so that science is a social activity. Okay, so realism in evaluation. There's something called realist evaluation. It's evaluation based on explanation, theorizing and explanation. A realist synthesis is a systematic review of the literature based on the goal of how programs work, not whether. Not did these diabetes programs, on average, based on my meta-analysis, reduce diabetes by 10%. It's how did it do that? How did these programs actually bring about change? What are the key critical mechanisms that bring about change? Okay, so those are complementary questions, different and complementary. So we deal with generative mechanisms, mechanisms that emerge from processes, and then also theories, middle-range theories to explain. So what is a realist evaluation? It's a type of theory-driven evaluation used in evaluating social and more increasingly health programs based on the epistemology of scientific realism. Based on specific theories, realist evaluation provides an alternative lens to empiricist or positivist approaches and to evaluation. And again, the technique assumes that knowledge is a social and historical product, and thus social and political context as well as theoretical mechanisms need to be considered in the analysis of programs or policy effectiveness. So the main thing to remember here is we're really about explaining why things work. We're about generating evidence on why things work, not whether, why. If we're doing an evaluation, a realist evaluation, we essentially go through 3 phases. Realist work always starts with our initial conceptualization of why things are. So we have our initial rough theory. Sometimes they appear in the form of hypotheses. Why is this program working? I think it's through these mechanisms, through this hypothesis. Then we collect evidence or review the evidence, and then we refine our understanding, okay? Notice it's not about computing outcomes, looking at odds ratios, okay? And this is just more of an expansion about how it's done. So we think about what are the theories that we know about that might explain what's going on here? A theory of change, because programs are all about change. If your program is not bringing about change, don't even bother. Then you collect your evidence, and these are the kinds of things that you might collect. Remember, all about why, and then you summarize your evidence in terms of your refined theory. So I just wanted to share with you one example of what results might look like for a realist evaluation. And again, this is just for your information so that you know that's on the horizon. You might be interested in finding a realist evaluation when you're summarizing information that might be relevant for your programs, in addition to knowing whether programs work and by how much. So look for some realist evidence because they'll tell you how and why a particular approach worked. So this is using a realist evaluation to describe and explain how and in what circumstances screening and alcohol brief interventions work in routine prenatal care. So, so they were explaining how it worked. So part of the results are that the training and the resources provided to midwives in prenatal care as part of the program acted as facilitating mechanisms that improved the midwife's skills and confidence to screen and deliver alcohol brief interventions. The programs elicited positive change in the attitudes to drinking in pregnancy and possibly stimulated drinking behavior change amongst pregnant women. However, the small numbers of pregnant women, so then that's just sort of a caveat about the findings. So you can see that really what we're trying to get at is how programs work. So what was it? It was something about how the midwives themselves were affected in terms of being able to more effectively screen and more effectively deliver the program, and also might have changed the attitudes about drinking during pregnancy as well among the midwives. All right, so you can find that if you want online, Doi et al. 2015. All right, so I know that was really quick, but I just wanted to introduce you to this idea of realist evaluation and realist reviews because they are becoming increasingly popular, and if you are an evaluator, I think you should be aware of them. So before we then move to logic models, let me just see, are there any questions at this point in time? Okay. Do you need to stand up and stretch before we go to logic models? All right, so just stand up and stretch a little bit, and we'll move into logic models because now you are going to be expected to work. Oh, crap. Okay, I think we should get started. It was supposed to be a stretch and not a full break. So before we get into, sorry. All right, I think the mic is on now. There we go. So before we get into logic models, I just wanted to fully make sure we go through each step of the evaluation logic model. So as we know, this is the CDC's evaluation model about the steps that we need to undertake for evaluation, beginning at the top here. So we have first, we engage stakeholders. Then we describe the program, focus the evaluation, gather our evidence, justify our conclusions, and ensure use and share lessons learned, and then kind of start over again, although engage stakeholders should really be throughout the whole process. So who has used this? Just raise your hand if you've used it. Great. It's a great tool. Is anyone seeing this for the very first time? Okay, that's fine. Thank you for being brave. The CDC evaluation book, which I don't think was included in your readings, is online. It's long, but it's very thorough, and I recommend that if you're doing evaluation for the first time, that you definitely look at it. It's a great guide. You have to supplement it with some materials that are going to be about, for example, the specific designs, or different kinds of data collection, but still, it's a great framework to follow. So I want to begin very briefly and quickly, just because I think this is an important step and I don't want anyone to think that it's not, with the idea of engaging stakeholders. So, who are the main users of the evaluation? Not so much who is going to conduct the evaluation, but who will be using the results of the evaluation. So you can create an evaluation stakeholder work group, or you can, whether they come together and meet all the time, or whether they're kind of on an advisory board is up to you, but you do need to engage stakeholders. You can't just do evaluation in a vacuum. Why? Well, there's several reasons why you should engage stakeholders. One is it helps to make sure that someone's going to be interested in seeing the evaluation happen. If you have an idea for an evaluation and you try and engage stakeholders and nobody's interested, you might as well not bother. It ensures that the evaluation addresses the priority questions about the program, because for any evaluation, whether it's formative, whether it's process, whether it's implementation or outcome, you're going to have dozens of possible questions that you can ask and answer. And so once you've decided, yes, I'm going to do process, or I'm only going to do outcome, you still have to figure out what is it about outcome evaluation that's going to matter most to the key stakeholders. Okay, so it helps you prioritize questions about the program. You can increase the relevance of your evaluation design by engaging the right stakeholders, including program staff, for example. They may tell you what's possible or what's not. If you run into problems along the way as an evaluator, perhaps engaging stakeholders can help you solve that problem. Also, it's going to make sure that people trust the evaluation results, because you had engaged stakeholders all throughout the process. And again, it's going to make sure that people will use the evaluation results. All right, so, you need a piece of paper and a pen, because what we're going to do is I want you to just write down 3 or 4 stakeholders for this maternal and child health training EPI training program. So just write down 3 or 4 stakeholders. Does everyone know what I mean by that? All right, so how's it coming along? Everyone has at least 2 down now, right? Give you 30 more seconds. Okay, so can somebody share one stakeholder with me? And yeah. Yes.
My boss.
Your boss. And your boss is, who is your boss? Not like what is her or his name, but.
The section chief in the department that I work for. So
Okay.
The department, the branch, the
Okay.
boss.
All right. So did anybody else write down something similar? Excellent. Okay. Let's think about our bosses or the people who sent us here. And let's think now, and we're going to have a discussion about this. What are, oops, something happened to my, my little, okay, so what are 3 to 4 evaluation questions that our bosses might have about this program? If in fact, we wrote back to them and we said, we are evaluating this program, what kinds of questions would they hope to see on that list? So if you could just raise your hand, and yes.
What new skills can we use day-to-day back in our home department?
Okay, so what skills did trainees learn that would be directly applicable to their jobs? Yes? Does that make sense? Okay. What's another question? I wonder if I can, let me see if I can write these down. It's not coming up. Okay, anyway, let's go on. Yes?
What sort of relationships did you build?
Say that again?
Relationships and networking? Sort of who did you meet? Who were you in contact with?
Okay, so your boss might want to know, who did the trainee that I sent meet? But why would they want to know that? What do they want to know about that? Not just, she met Sally and Jane.
Sort of their, again, sort of back to sort of the all work you're doing internally, like contacts and people you could reach out to for either support in a project or TA assistance in the future.
Thank you. Okay, so did they meet someone who might, in the future, be resources for my employee? Is that right? Here we go. Okay, what else might a boss want to know? Yes?
Recommending other staff that may benefit for the training in the future. Like what kind of staff at the health department would benefit when you get that?
Okay, so who might I send next year, kind of a thing? But would that be a full-blown evaluation question? And maybe I should go back. Do you think that would be a full-blown evaluation question? Even though this is a question that my boss might have, is this an evaluation question? Let's just go back for a moment. This might be hard to evaluate. I think the first one, which was what skills were learned that are directly applicable to day-to-day work. I think that one might be. I'm not sure about this one. It's a question, for sure. But is that an evaluation question? So think about that for a moment. And then what staff person should I send next year? That definitely is a question, but is that an evaluation question that would inform what we're going to evaluate here? I'm not sure. Yes?
I kind of wanted to riff off of that a
Yeah.
One thing that I'm really excited about is being able to bring back what I learned to the other folks. So maybe it'd be a question of, do I need to send someone next year because, or like, because are there parts of this that can be disseminated from me, the person who's been here, to the rest of the staff? So we might not need to, you know. Be transferred maybe or shared, yeah.
Staff, I'll just say back home, um, to build their evaluation capacity. Okay. So, yes, I think that is related to this. I'm just trying to think about, could we evaluate that here? I guess we could in a question. Did you disseminate, were those materials useful? Okay, good. On this side over here. No one has any questions?
I think the big question that I can't think of any way to answer is really, is it worth it? Do the skills that we gain warrant losing our productivity for a week and the cost of a plane ticket?
Okay, so when would you measure that? At what time point would you measure that? So this first one here, what skills were learned that are directly applicable to day-to-day work? That you can probably demonstrate in the first 3 months, maybe, yeah? But when would you measure that? Is it worth it?
I have no idea, that's why I wasn't going to say anything.
Do you think in the first 3 months you would be able to measure that effectively?
Oh, no.
Maybe that's a year later, maybe even more than a year later, 18 months later. But you could. But that would be harder for us to evaluate here. Okay, one more, and then let's move on to another stakeholder. Yes?
I was going to say, in line with that, one question is how much has the work, how much has our work been enhanced because of those skills? So that would be a question for the directors or the bosses to sort of ask, well, based on their participation in this training, bringing back those skills, how much do you feel that work has been enhanced because of that participation in the training?
Okay. So it's just a different perspective than the other one about skills. Okay, good. So that one, we'd have to write to the bosses to do that, or the direct supervisors or something like that. Okay, one more stakeholder from that side of the room. Yes? City Match. All right. Who else had City Match? Wow. All right, City Match it is. Okay, so are they the same or are they different? So which one do you want? Who had HRSA? More people at City Match. I find this one challenging. City Match. Let's do it. What are some questions that City Match has about this? Yes, go ahead.
How do trainees feel their work is going to change, or what they do in their day-to-day work is going to change as a result of this training? What am I going to take back and do differently?
Okay. Kind of, so sounds like this stakeholder shares something with the boss because the boss wants to know if skills were learned that are directly applicable to day-to-day work. Okay, yes, another one for City Match. Yes?
So, if I was with City Match, I'd be saying, so what did we learn from the trainees?
What did City Match learn? Okay. What? And do you think that's that would be answer? So the question is, what did we learn from the trainees about what their needs are? And I'm trying to think about what part of the evaluation would that.
I don't know, but it seems like that's what they're always asking me.
Oh, so you want City Match to fill out your evaluations for you? Okay.
What they're always asking is, did we deliver what
Yeah.
they need?
Yeah. I get it. Okay. There was yes.
What are the most successful and least successful parts of the training?
But how how would you measure success here?
What courses in the training were most successful in a didactic manner, and what teaching styles had the best impact on trainings,
Okay.
and also what subject matters were the most relevant to training.
Okay. And we still have to figure out what that means. So is it that you learned skills in those areas? Is that defining success? Is it that, sure, you learned skills, but bottom line is I'm actually applying them in my day-to-day work, or they made an impact on programs back home, kind of a thing. So we'd have to figure out what we mean by that. Yes?
What courses or topics were missing and could you identify as missing from the curriculum?
Okay. That's also broad. So we'd have to figure out what does that mean, missing how? Missing from just day-to-day work, from specific programs, a particular area of impact. But yes, we could probably do that. Okay, so I think you get the idea, right? So we have to figure out who our stakeholders are. Our stakeholders are going to have sometimes unique questions, sometimes similar questions, and then if we had more time, we could say, okay, for City Match, which one of these would be most important? And ideally, we wouldn't guess for them. We would ask City Match, which one of these do you care about? But these are all important activities to undertake in order to know how to do the rest of, whether and how to do the rest of your evaluation. Okay? All right. Now let's see if I can. Okay. All right. So now we are going to go to logic models and describe the program. We are very familiar with this. We're going to be talking about logic models. And again, reminder, logic models are for simple and complicated programs. All right. So, quick show of hands, who's familiar with a logic model? Who's actually used one? Okay. Who's never seen a logic model before? All right, a few folks. So it sounds like this is probably a review for most of you. So I'm going to go kind of quickly. Feel free to ask questions. And you also had a pretty good reading about logic models, actually, which explain them very well. So logic models provide a needed kind of synthesis of your program. It's all in one map, all in one place, to successfully convey why your program is important, as well as the logic behind why you expect it to succeed. And it's an iterative tool, so it changes. It isn't static, and it provides a framework to revisit throughout program planning, implementation, and evaluation. So it has several components. Some of the early parts of the logic model is about your planned work in the program, so what resources you have available, and then how you're going to use them to implement certain activities. And then your intended results are your outputs. So what will you deliver, and by how much? How much of that will you deliver if you're able to successfully implement your activities based on the resources you have? And then what are your short and long-term impacts that you hope to achieve based on your resources, your activities, your outputs? Also, what's not depicted here so well, but is very important, is this idea of why, right? What are the assumptions underlying those activities? So programs are not just about a collection of activities. They have a reason behind them about why change is going to come about. And again, as a reminder, programs should be, logic models should be shared with all of your stakeholders so that everyone understands what the program is doing. And it's critically important that all program staff understand that as well. I can't tell you how many times I've visited a program and not even the program staff are on the same page about what the program is intending to do. In part because there's no logic model that has been shared, or the logic model is not current, etc. All right, so another reminder, logic models and theory of change have to say the following components: who you're seeking to influence or benefit, like who's your target population? What benefits are you seeking to achieve? Those are the results. When will you achieve them? Short term, long term. How will you make this happen? So the activities and the strategies. Where and under what circumstances will you do your work? Is it community-based? Is it clinic-based? Is it organization-based? Is it online? And then why do you believe your theory will bear out? These are the critical components that have to be in a logic model. It's not the picture that matters. It's not the boxes and arrows that matter. It's find these pieces of information however you decide to put your logic model together. All of these components should be there. As an example, there's this parenting program here, which has as inputs or the resources, the staff, the money, and the partners. And then they put that together to target parents with a parent education curriculum, specifically 6 of them, and these are interactive sessions, and they hope to achieve what? Increase knowledge of child development, and learn different ways of disciplining their children, and then also improving parent skills to ultimately reduce rates of child abuse. What's missing from here? Okay, time, but short, medium, long. We'll say that's time. Education curriculum, 6 sessions. Go back to the last slide. Yes, is that what you're going to say? Assumptions, thank you very much. All right, here's our assumptions. So the cause of child abuse is unrealistic expectations by parents about what children are able to achieve at a certain time. So this provides you realistic knowledge, appropriate developmental stage or age-appropriate skills for disciplining, et cetera, et cetera. So yes, these are the assumptions. This is why. So sometimes logic models, and also, so the other thing about this version of a logic model is we have our assumptions here, but then we have our key evaluation questions that can be asked, for example, about implementation. Was the curriculum developed? Were all the 6 sessions delivered? Did the parents even attend? Or outcome evaluations. So I like logic models because they can help line up key evaluation questions and indicators. So we can have key evaluation questions by stage, outcome evaluation, formative process evaluation, maybe the specific indicators for outcome evaluation or process evaluation. And then what do stakeholders care about? Do some stakeholders only care about outcome, or do they care about process? And then what report might I generate for implementation evaluation or outcome evaluation? So you can really use that logic model to make sure that your designs and your activities and your stakeholders' priorities are all lined up. Okay? All right, so this is now a test. Who do we share our logic model with? Did everyone hear the answer? Okay, good. Has anyone done that? Only one person. Only one person's done that? Okay, hands high. Who has shared their logic models? Hey, what is it about this side of the room? Okay, so tell me how you've done it over on this side of the room. How have you shared your logic model with everybody?
I'm not sure it was with everybody, but I shared a logic model with the steering committee,
Okay.
and it was in one of the meetings, and so we had set time aside to actually look at the logic model and revise it.
And revise it. Okay, so who is on your steering committee that can help you revise it?
The stakeholders.
But which stakeholders? Like, who were they?
So, for example, some of the program people.
Program staff, excellent. Okay. Who else has a how story to share? Anyone else on this side of the room had a different experience? Yes. That's okay.
So we were tasked with evaluating a program that had existed for a while. The people who designed it never created a logic model. So as the evaluators, we attempted to do that and share it with program staff. We couldn't really get them interested in it.
That's a common experience, that programs don't create logic models, or funders don't create logic models about what they're expecting. And then the most common experience is no one shares what their logic model is. So thank you for sharing that. What happened in the end? You just dropped it?
We're still in the process of evaluating. I feel like we never finalized the logic model because we never got them to comment on it. And we had a draft, but we didn't get there at some point.
Do they understand what the logic model is for?
No. I mean, it's hard to explain it, but it's hard getting them to even come to meetings, to be honest.
Okay. Hard to comment on something when you don't come to meetings. Yeah. Okay. Thanks. Yes.
I integrated a logic model in our critical mental heart disease screening site visits for the hospitals. We wanted to create a consistent template out of that and gave that the program information to all the hospitals because different hospitals are treating different types of patients. And in that presentation, I believe we integrated the logic model.
Okay.
I got some feedback from nursing staff.
Okay. And what was the kind of feedback? Were they like, yeah, this is perfect, or what?
Well, I think it really demonstrated a disconnect between what was going on within the state health department and then what was going on in labor and delivery units.
Yeah.
So
Yeah.
it was good to kind of highlight that and that it was investments to also communication.
I'm just going to share a story with you. So we had a situation much like yours. I'm sorry, your name is? Chrissy. So we are evaluating an integrated health and housing project where in social housing in Toronto, there's some buildings which have lots of problems and people who are overusing the health system. So the Ministry of Health and the Ministry of Housing are interested in joining forces to implement some programs that will help reduce the kind of risk profile of that building. So we are doing an evaluation of that, and we went in and we said, okay, where's your logic model? And they're like, what do you mean? We don't have one. So we then had a staff meeting, and we just asked them, what do you do? We actually had these big stickies. We said, okay, what do you do? And each person on that team, and there were multiple buildings and multiple teams, had a different role because it was sort of a multidisciplinary team. So different people had different things. So on the stickies, they would write what they did or write what they, some people would say, I'm kind of making this up, I focus on substance use issues and reduce substance use. So we'd put that up there, that's an outcome. We say, okay, how do you do that? And we would work backwards. So in the end, we had this kind of wall with stickies on it that they created. So we helped put it together in logic model format, because we could ask questions, does that happen right away or does that happen over time? And so then that was one way that we co-created one or got them to create a logic model. Then when we typed it up, they saw their work there and they owned it more than if we just interviewed them on the phone or something and then wrote something up. So that might be one strategy for engaging some of the folks, Chrissy, if maybe they created it instead of reacting. Okay. All right, so any other burning house, somebody want to share that's different from what we heard? Yes.
We were looking at we haven't done it yet, so we have our standard logic model, and then we have a 2-page summary sheet that goes over the scientific rationale and the assumptions really clearly, but we've been looking at the cascading logic model to integrate our implementation outcomes.
Okay.
We haven't quite got there yet, but I think that will probably be our next step, and we do use a lot of CQI techniques,
Mm-hmm.
why, and 5 whys, and the fishbone diagram, and things like that. So that's been helpful for us to move into a more transparent place.
Do you want?
It's kind of scary to share. But
Okay.
It's been really, I think, good.
Have you been sharing along the way, or are they just going to see something
We've been
fully
sharing
formed?
along the way. We've been working on not sharing at the end of the process, but having our stakeholder community really be engaged in it.
Okay. So do you want to explain to everyone what a cascading logic model is?
I'll do it well. So we have our standard logic model, which is basically your inputs and your outputs, but then we have the cascading parts of it talk about what are your implementation goals. So talking about how is fidelity an outcome of your implementation inputs. And so it doesn't, the problem is it doesn't fit on one 8 by 11 sheet of paper.
Mm-hmm.
So it's sort of wrestling with how do we make this, you know, we can't bring a poster with
Right.
us everywhere we go. And so that's been one of our challenges. And an Excel workbook is hard to do too. So it's hyperlinked. So it's the logistics of getting
Yeah.
our logic model, which is really complex, onto an 8 by 11 sheet of paper in more than an 8-point, an 8-point font or more.
Right.
So we're struggling with that.
Okay. Thank you. So here's a complex logic model. This is the Healthy Start logic model, which has multiple levels of influence, right? So we've got, who's seen this? That's it? No more? It's hard to read, it's true. Okay, so we've got program participant level, we've got our organizational level, we've got our community system level. So that's already a complicated process. I'm not going to read it to you, but you've got your activities that are happening at all the different levels and your outcomes at the different levels and short-term and long-term. So I think you'd need a bigger sheet in order to be able to see that. But this is an example of a logic model that's kind of multi-level and complicated. Simplified something that I wanted to point out about the multiple levels, and that is that at each level, some of the assumptions about what's happening is going to be different and appropriate to that level. So, for example, we've got the participant level, and the goal is to improve housing stability, economic well-being, and family health. This is related to the Healthy Start in Housing that we're going to be working on for our logic models and our exercises today. So here we're focusing on integrating housing and health. Our organizational level activities are intended to improve the organization's ability to work with a health and non-health sector, so cross-sector, serving clients and improving the social determinants of health. And then cross-sectoral level is improving communication, coordination, and partnership and cooperation of sectors on joint initiatives. And then how do we do that? Here's our assumptions that at the participant level, helping clients address some of their urgent needs are going to enable them to be able to focus on prevention and health improvement with the right supports on becoming economically independent and being able to maintain housing, right? That's our assumption at the individual level. Our assumption at the organizational level is that prioritizing non-health initiatives requires a culture change for a health organization, and that shared language and frameworks are also necessary elements, as long as, formal, forgot the F, formal processes and monitoring and feedback are also important to make sure that those processes are put in place very well. And then for cross-sectoral, some of the assumptions are that partnerships are more than just two groups working on a common problem. It really requires shared values, formal strategies, and kind of a win-win approach. So whatever we're working on, it has to benefit both organizations to promote buy-in and joint ownership with or without additional resources. So these are kind of the assumptions behind the activities. We're going to see specific activities, but these are the assumptions behind those. And they're different for the different levels. Okay, I just want to make sure that people understand that, and then that's clear. Any questions about this? Great. So I just kind of threw this in there in case it's useful. So this is from a document that focuses on what is needed to move the needle from, say, two organizations that are different cooperating with one another to actual partnership. And some of the necessary ingredients are having a common agenda for the issue. So both groups or multiple groups have to have a shared vision for change and a common understanding of the program and issues from both or multiple perspectives, and then a joint approach through solving it. There should be ideally continuous communication, so not just meeting once a year or a couple times a year, but consistent and open communication. Again, some of it is to build that common agenda, common language, common understanding, and to help some of these mutually reinforcing activities. And then finally, ideally, a shared measurement system so that success or failure can be measured for both organizations in terms that would be relevant for both organizations. Okay, so I think we're going to move now to the exercise on logic models. Yes, we are. So let's see, what do we have here? Did we hand out the logic model exercises yet, or can we? I'll take a stack. Yeah.
Also, while we're doing this, we actually paired you up. So on the Google Drive, there's the document in the Thursday folder that lists who your partner is.
Did everyone find the pairing up list?
I posted it this morning, so you might not have seen it. Is it in?
The Google Drive.
It's in Thursday, so just like the main folder, not exercises. Just the main Thursday folder.
I'm going to take one. Thanks, I forgot to print this out. Okay, so before you go find the person that you're going to work with, so you're paired up, and we're going to be working in those same pairs for 3 exercises today: a logic model, process evaluation, and outcome evaluation. Okay? And so I have provided you with a logic model for the Healthy Start in Housing project. And the Healthy Start in Housing project has 3 levels. We'll go back to our levels here. So there's a participant level of intervention. There's an organizational level of intervention. So if you turn the page, you're going to see. So the first page is not participant. Is that the last? Okay, so the last page is participant. And the first page is organization, and then the third page, middle page is cross-sectoral. Does everyone see that? All right. So there's a unique logic model for each level because, as we just mentioned, the assumptions for each level and the activities for each level are going to be different. Okay? And so what I'd like you to do is to kind of get in your group or your pair. And you'll notice in this version here, there are some blank boxes. So if you can fill in the blanks for at least, ideally 2 levels, but definitely do 1 level. And we're not going to spend a lot of time on this, maybe, let's see what happens in about 10 minutes or so. Okay?
And also, just quickly, the participant level is in 1.5 pages, and if you're wondering what the acronyms are, it's at the back of the second page.
Any questions before you pair up? All right. 10 minutes.